Okay. Can you see my slide?
Yes, I can.
Okay. So thank you very much for inviting me. So today I want to talk to you about ways we as youth can join the fight against AMR and how we can take charge in combating the problem that is antimicrobial resistance. Can you see my second slide?
Yes, I can. Yes.
Okay. So most of what I will be saying, I will use myself as an example, and there will be strategies that I have taken advantage of that I am actually currently utilizing. And it's the same thing that I've seen other youths use. And I hope that no matter what, at the end of this talk, you're able to take at least one thing and using it. So I'll be talking about the causes and impact of AMR, and I'll give a few facts about the youth demographic in Africa and Nigeria and the barriers to youth action. And I'll also be talking about the strategies that we can use to overcome those barriers. So I wanted to start with a scenario. So, and I am almost certain most of us here are students, so this should be really relatable. So this is a college student, let's call her Sarah. And during her exam week, she got really sick with symptoms of cold. And Sarah, usually when she gets sick, she takes antibiotics and she gets better. But this time around, even after taking her medication, there was no improvement. So she saw a doctor, and that's when he told her that the antibiotics will not work, possibly because the bugs are resistant to the drug, or the main cause of her symptoms is actually a viral infection. So, her exams came and it was looming, and she performed poorly in her exams. And as students, we know getting sick during exam is one of the worst things that can happen. And now imagine the possibility of actually getting sick with something as common as the name implies, a common cold, and not being able to treat it. It's threatening due to AMR. So like, what is antimicrobial resistance? And I'm sure this is, most of us here are AMR advocates, and this webinar is a webinar series that's been happening for quite some week now. So I'm sure most of us have been hearing what AMR is, and we can possibly already define it in our own words. But really, what is AMR? So Dr. Keji called it the single greatest challenge in infectious diseases today. That's microorganisms evolving and adapting to drugs that were previously effective against them. To me, this means AMR it has the potential to jeopardize modern medicine, and it's already jeopardizing modern medicine actually. So what are the causes of AMR? Although mutation occurs naturally in microorganisms, I am a microbiologist, so I'm going to go a bit deep for some of you that are not microbiologists. So I'll be talking a lot about microorganisms. Although mutation, it occurs naturally in microorganisms, there's still a number of factors that play significant role in their adaptability. And I think it's safe to say awareness is a major factor. And I think it's a factor that plays a role in all of our other factors, kind of like a factor within a factor. And yeah, so lack of awareness, it can lead to misuse and overuse, and also unethical farming practices, such as using antibiotics for growth enhancers. It's also a major cause of AMR, and poor drug disposal methods. This can also be due to not only lack of awareness, but I think due to poor regulations as well. It's something that's really lacking in the African space. And poor IPC, that's poor infection prevention control practices. Again, lack of awareness plays a role in this, because and lack of awareness plays a role in this, and it also plays a role in poor regulation as well, especially in low and middle income countries, which unfortunately we are. And antibiotic discovery void. So I'm sure the speaker previously mentioned this. There hasn't been a new class of antimicrobial in a very long time. And I think also lack of awareness plays a role here. I had to put it here because I feel like a lot of people don't know this. And because they don't know this, they don't understand how serious the situation is. Okay, so the impact of AMR. The impact of AMR is really worrisome. I mean, that's why we are all here right now. The danger that it poses. Like I said earlier, it has the potential and it is already jeopardizing modern medical practices. So we end up with limited treatment options. And AMR it's an economic burden due to increased healthcare costs. Being infected with a resistant bug, it can lead to prolonged treatment and prolonged hospital stay. And most of these treatments, you find that they have to use last line drugs. And these drugs, they are very expensive and they're very coveted. So that means more money is being spent on treatment. And that in itself is another factor. It's another impact. And again, if we think about the scenario at the beginning, that's also an impact. AMR has the potential to affect our daily life and our productivity. And again, in agriculture, the use of antibiotics in livestock farming, it contributes to resistance developing, and this can decrease livestock productivity. So just the way it's decreasing human productivity, right? Just the way it's affecting our life, it can also decrease livestock productivity. So that means the farmers will have to think about, because the animal will be sick, so the farmers have to start thinking about the veterinary cost, and this would definitely reduce profitability for the farmers. So what is also inevitable is the fact that AMR can lead to increased illness and can lead to death. So in all this impact, I think we can see how AMR is affecting everybody, from as high up as policymakers, that's in terms of economic burden, to local farmers and the general public. So AMR it levels the ground. So everybody is a stakeholder. It's not really isolated to a particular group. So it's not just for science students or maybe a disease in pregnant women or the older population. It's just levels everybody because everyone is a stakeholder. Okay, so these are just a few facts that I wanted to bring to our attention. The fact that Africa has the youngest population in the world, and over 60% of the population are under the age of 25. And with Nigeria being one of the most populous countries in Africa, we can, from there, we definitely contribute to the demographic really significantly. And it has also been estimated that by 2035, there will be more African youths in the workforce than the rest of the world combined. So why do we matter? Like, it's our future on the line, right? And we're already seeing the impact of AMR right now. It's not a distant problem to come, it is already here. So we have the potential to make long-term positive impact. We are young with fresh ideas, flexible in our thoughts and in our creativity. And as youths with our capacity, in this day and age, we are more uniquely positioned to make a difference in the fight against AMR, and we can demand for action and push for change. And I want to use the example of Twitter, although it's informal, we see a lot of that actually happening in Twitter spaces. And over 90% of what we do is digital. So we are tech savvy, and it's very easy for us to adopt new technology and, utilize digital platforms. So with all this, we can see that mobilizing youth as a goal, it's not something that in any way should be discouraged or overlooked. So I'm not going to, gloss over the fact that we don't face challenges as youths in the fight against AMR. Um, Knowledge and awareness, access to information on AMR, it can be limited, especially in our communities. And understanding the technical aspects of AMR and its implications, it can be challenging for youth without the proper support. And this brings me to misinformation. So the disadvantage of readily having information now, you can just easily go online. The disadvantage of that is the fact that sometimes the information online is actually not synthesized, so we are vulnerable to online misinformation. And this is something that is a barrier, and I think it's something to really, really look out for. For access and resources, the the lack of financial support, it's a real problem, because even with brilliant ideas, successful implementation, it relies a lot on funds. And I'm also currently, personally, I'm also currently involved with a student-led public health organization, that's Africa PHSN, and I'm the head of advocacy. So I can tell you that organizing awareness campaigns, like workshops or any advocacy initiatives with the aim of reaching a wider audience, you will need financial support. And within this access and resources, I think lack of mentorship, this is something that the previous speaker spoke on. Lack of mentorship and guidance, especially at the institutional level, it's a real constraint, because you would imagine you would have to find a mentor that is an advocate, that is a professional, that is also willing to take time to actually mentor youth action. So I think that is a real problem as well, just like the previous speaker mentioned. And for power and influence, if you think about it, youths have limited representation in decision-making bodies, especially at the government level. So the lack of youth representation in things like policy forums, it can be a real struggle for us to get our voices heard by policymakers. And we are often, this is something that is common, we are often perceived as inexperienced. And in a way, this still rolls back to having a mentor. Sometimes experts and professionals in the field, they tend to underestimate the capacity and the potential of youths to contribute meaningfully to AMR solution. And that is really an unfortunate challenge, to be honest. For motivation and sustained engagement, well, as youth, we have competing priorities and distractions. I want to believe like we're all students here. And I think this is something that we can easily relate to, being able to balance your academic workload, social life, and any kind of advocacy efforts. It can be challenging. It can be really, really challenging. And we can easily get discouraged by slow progress. So this is something that is a real problem. I also put language as a barrier here, because it's also a problem. um Being able to access information and participate in advocacy efforts, it can be restricted by language. And in communities that, the African community, in a community that is as diverse as our own, we can see how, when we want to reach a wider audience, it can be a real problem, because we can't pass the message across effectively. And that's one of the most important things, being able to pass your message across effectively. I want to discuss a few strategies we can use to overcome some of those challenges. I'll be discussing how education can break some of those barriers to youth action, how to be involved with youth-led organization, how advocacy and research also plays a role, as well as technology and innovation, and also capacity building. So I know we're all in the university, right? And as cliche as it's going to sound, education can break a number of those barriers that I mentioned earlier. We can be educated even outside the institutional settings. And gamified learning is a good example, designing interactive simulations that would simplify concepts like maybe antibiotic overuse, or how to responsibly use your medication, and actually making it fun. So this is a concept that has been utilized by Students Against Superbug. I don't know if Daniel is still in the audience, because this is his organization. And I've put the link on there to the game for anyone who just wants to go through it. I think it's such a good and fun way to actually learn about AMR. And it can also inspire you to want to do something similar, or even better. And we can also encourage informed debates, even within our groups, even within our organization. Debates can be about maybe ethical issues surrounding AMR, or the effects and dangers of over-the-counter medication, because that's something that is rampant around Africa, especially in Nigeria. Or we can even utilize bringing in policy. We can utilize policy issues that surrounding AMR in our country. For organizing peer-to-peer education initiatives, I believe the previous speaker also spoke a lot about this. Youth leaders can be trained to educate their peers. This can be through workshops or presentation. We can also use engaging platforms like student blogs or Instagram. We're all on Instagram to share fun facts and information about AMR. So just to reach a wider audience. And I believe mobilizing a youth-led organization is a really good step that can enable discussion, especially between youths and either healthcare professionals or researchers or even policymakers. And this can be another way of breaching the knowledge gap as well. So this is something I would definitely encourage: being involved with youth-led organizations or organizations that have a vested focus on youth, or organizations that support early career professionals. And I hope when I say during my undergraduate, it doesn't sound like I graduated 10 years ago, because it was just 4 years ago. But yes, during my undergraduate, we didn't really have an AMR youth club, and there wasn't much awareness on the fact. And this is even me talking about it as a microbiologist, right? So after my service, I did a 3-month AMR internship program with Ducey Blue Foundation, and I later on got excuse me, I later on got involved with Africa PHSN and Students Against Superbug Africa, and a lot of other organizations along the way. So getting involved, it can be through direct membership. You might have like an official position in the organization, or participating in the organization's initiatives, kind of like this webinar series basically, or internships, or any kind of forum discussions. So some of these organizations like Pearl Foundation, they actually offer grants, and a good friend and colleague of mine was one of the recipients from last year. And I've also applied for grants with South Center on behalf of Africa PHSN. And I think we got the funds for both 2022 and 2023. So yeah, 2023, that was last year. So we got these funds for our AMR advocacy programs. And I guess even my interaction with Zakaria, it's kind of, I think it started with when we collaborated to apply for a grant as well. So, being involved with these organizations, it is such a great way to actually connect with like-minded people and also learn and gain amazing skills. And, in most of these situations, these skills are actually transferable. It's not something that you learn and just leave. It's something that you take with you, and you don't necessarily have to use it maybe in the AMR space. It's something that you can use for your continuous professional development. And sorry. And also being involved, it keeps you motivated, and it gives you the opportunity to decide what really interests you about AMR, and what particular niche you might actually want to focus on, or where exactly you want to make an impact on. So for me, the internship that I did with Ducey Blue Foundation, it actually made me realize how the environmental dimensions of AMR is really neglected, even within the concept of One Health. And I personally found that interesting, and I wanted to learn more on what is being done to bridge that gap, and why the environment is actually really important with regards to antimicrobial resistance. And again, in most cases, you find that you gain certificates for these participations and an engagement, right? And this is something that you can show on the long run about your CPD, that's your continuous professional development. So this strategy, it is a good way of, it kind of answers that perception of inexperience lens that professionals usually view youths with. And it also gives you an idea of how to get funding for your programs. Okay, advocacy is such an important tool. I think it's such an important strategy because it helps to facilitate how we can address a lot of these barriers against youth action in AMR. We've established earlier that knowledge and awareness is a barrier, and advocacy addresses this because it gives us the opportunity to utilize different strategies, be it through social media or maybe having creative materials like infographics or posters or videos that can really, really simplify the complex AMR information. And with effective advocacy, we can reach a diverse, excuse me, just have a call, unfortunately. I hope that didn't cut me off. Hello, can you hear me? Hello?
Yes, I can hear you. Yeah,
Okay,
I can
okay.
hear you.
Sorry, a call came through.
Okay.
Um, okay, so I said advocacy addresses a lot of this because it gives us the opportunity to utilize different strategies, be it through social media or having these posters and videos to simplify AMR, to simplify the information surrounding AMR. And with effective advocacy, we can reach more people. We can advocate to community leaders, we can advocate to healthcare workers and policymakers about AMR, and we can even organize events within these groups and in partnership with these groups. So I think advocacy is really important as well. And youth action can also be through research. And I know I keep going back to the fact that we are students, and there are a number of AMR research areas that one can choose to focus on. And youth can participate in existing research projects. And being in university already, it's a lot easier. It gives you more opportunity to participate in research, and I'm saying this because, during our final year, it's our project year. So that opportunity should really, really be capitalized on. And with research, we can try to bridge knowledge gap as well. So WHO has this list. I don't know, maybe most of us already know about it. So they have this list of AMR relevant research areas, and I think it's something that you can easily utilize, and it's really important as well. But even outside the educational institutions, research can still be carried out. I believe that's also one of my interactions with Zachariah in the past. I think not just applying for grants, maybe we also were collaborating to write some journals for publication. And I wasn't even in university then. I think I just finished my university. So what I'm trying to say here is that we can mobilize efforts to carry out research even outside the university settings. And we don't just wake up with the knowledge of something. Sometimes it actually takes practice. So I believe this kind of endeavor is a good way to learn and to practice your research skills. Plus, it kind of keeps you informed on the latest news regarding your research area. Okay, so through technology and innovation, we can develop creative solutions to combat AMR. Like I mentioned earlier, as youth, we are flexible in our thoughts and in our creativity. And one way we can use tech to sustain any kind of advocacy we are doing, or we can explore innovative approaches, is through digital health tools. So some of these tools, they are used to help promote antimicrobial stewardship programs, especially in the healthcare settings. And some are used to monitor real-time antibiotic prescribing or resistant pattern. So they're also used to generate data. And I know, most of us, we already know that data is something that is actually lacking in the African space. Mobile applications. So just what we're doing right now, it's actually a really, really good example. We are all from different places, and we're still able to connect and interact and learn using Google Meet. It can be through Zoom or WhatsApp, Twitter Space, or Instagram. So all these platforms, they can be used to sustain discussions and other programs as well. And gamification, I know I mentioned gamified learning earlier, but this is it's actually really important because these apps and games, they can be designed to teach not just us, but also the young people about the importance of using antibiotics responsibly, or possibly the mechanism of AMR resistance. And like, it can also, with these apps and games, you can also show a person how they as an individual can actually play a role in combating antimicrobial resistance. And these tools are interactive, and they make learning about AMR very engaging and very, very accessible. And it also has this potential of promoting long-term understanding and behavior change. And I believe this is something that the previous speaker also spoke about, because what we want at the end of the day ultimately is the behavior change. It's not just passing your message or talking about AMR. It's how effectively did we pass that message across, and that is defined with the behavior change, right? We want to make sure that that behavior change is sustained. And lastly, I just want to bring, excuse me, I just want to bring our attention to capacity building programs. And I'm sure we can actually classify this webinar series as a capacity building program, because it is equipping us with the understanding and the knowledge and the skills and the resources to actually address AMR effectively. And these programs, they can also be workshops, they can be mentorship opportunities or training sessions. I think it's a really, really good way to connect with other people and to really build your own expertise. Okay, so this brings me to my last slide, which is just a highlight of the message I'm actually trying to pass across. So start small and build your momentum. Choose the actions that are achievable. We all know the SMART goal, right? And gradually scale up your advocacy efforts. Collaborate and build partnerships. So you can partner with other youth groups, other NGOs, and establish your organization to amplify your voice. And also use data and evidence. So base your advocacy on facts and research, because this would definitely increase your credibility and your impact. And also be persistent and stay engaged. Fighting AMR can be a long-term effort, so maintaining your commitment and continue advocating for change is really important. And I would just like to leave us with this. So, a mentor of mine, she always asks this question about value added. What do you bring to the table? Now, the way I interpreted this was to continue learning and to gain skills that would really make me stand out. And I hope it's something that you can also take into account in all that you do, being involved with the fight against AMR, because the inevitability of it is that you would gain invaluable skills, and this would help you stand out in the future. Okay, once again, thank you so much for having me. If there is any question or anything you would like me to clarify, please let me know. And these are my emails if anyone wants to reach out to me. I know I was given a 45-minute slot, but I used less than that, and that was deliberate. I wanted to make sure that I passed my message across, and I didn't take too much time. So some of us, I know this is the second presentation, so I don't want us getting too bored. So yes, thank you so much.
Okay, thank you very, very much, Maryam. Thank you very much for your time and the thoughts put together to bring forth this